This one simple ingredient helps your arteries heal, and it works faster than most people realize. If you're living with high blood pressure or heart disease, there's something happening inside your body, and you're not going to feel it at all. Your arteries, those smooth, flexible tunnels that carry blood to every corner of your body, they're slowly becoming tighter, stiffer, harder, less willing to move around with each heartbeat. The worst part is that stiffness builds up. Your blood pressure rises, and you know what? You're not going to feel a thing. That's what makes it so dangerous. You can feel perfectly fine one moment, and the next collapse from a heart attack or stroke again. Half of heart attacks' first thing you see or feel or hear sudden death. Part 1, meet the molecule. The ingredient we're talking about is L-citrulline. No, it's not a prescription drug. It's an amino acid. It's a building block for a protein. It's found naturally in watermelon. In fact, that's where its name comes from. Citrullis, that's Latin for watermelon. Your body turns citrine into another molecule called arginine. And that's where the magic happens. Arginine makes nitric oxide. That's the molecule that tells your vessels, your blood vessels, your arteries to relax, open up, and let that blood flow freely. Now, when nitric oxide levels rise, your arteries open wider. They relax, blood pressure goes down, oxygen delivery improves, and your heart just doesn't have to work as hard. That's why I sometimes say citrulline is like Viagra for your arteries, minus the awkward conversation with your pharmacist. Part 2, The Science of Nitric Oxide, Dr. No and the Nobel Prize. Back in the 1990s, Dr. Lou Ignarro, he was on the show last year. Yes, Dr. No, NO, nitric oxide. He helped discover that nitric oxide is a major signaling molecule for the cardiovascular system, for the vascular system. He and 2 other scientists won the Nobel Prize for that work. It led to so many things like nitrates for angina heart pain and more recently Viagra and Cialis for erectile dysfunction. Their discovery changed everything. We learned that arteries are not stiff pipes anymore. They're living, flexible organs that open and close depending on how much nitric oxide is around. So here's the kicker. As we age, our nitric oxide levels drop by more than a half. That's one of the reasons why blood pressure creeps up in your 50s, your 60s, and 70s, and why workouts just don't feel the same anymore. Less nitric oxide, less than half, means less oxygen to your muscles, slower recovery, and you know that feeling that the old engine's just not turning over as well when you get started moving in the morning. Part 3, Citrine versus Arginine. Now, if you've been thinking about it, let's go back to this thing. If nitric oxide comes from arginine, why not just take arginine? Seems more direct, right? Well, it is more direct, but here's the problem. It's a good question, and scientists have already gone there. It turns out swallowing arginine just doesn't work very well. Your liver breaks it down before it ever reaches your bloodstream. So you just don't get the arginine. Citrine, on the other hand, is bypassed by the liver, or it bypasses the liver. It floats around for a while, and then it's quietly converted to arginine inside your tissues, giving you a steadier, longer boost in nitric oxide. Think of it like a time-released version of arginine. That's why citrulline, not arginine, has become the supplement for athletes, people with high blood pressure, and yes, even men with a little performance anxiety south of the equator. Part 4, Blood Pressure and Exercise Benefits. Several clinical studies shows citrine can reduce blood pressure in just a few weeks. It improves arterial compliance, meaning your arteries expand and contract far more easily. And it helps your muscles move oxygen more efficiently. use that oxygen during exercise. That's why I recommend it not just for blood pressure, but also for stamina, whether you're walking, cycling, or still just trying to impress your spouse on the dance floor. In one study, older adults who took citrulline before workouts saw greater endurance, lower perceived exertion, and the translation: you can do more with less strain, and that means more blood flow where it counts. Yep, some of my patients report unexpected bonuses in the bedroom. Let's just say their spouses became very supportive of my supplement protocol. Part 5, Erectile Function and Vascular Health. This isn't just about romance. It's about circulation. Erectile dysfunction is one of the earlier signs of vascular disease. If blood can't flow easily through the small arteries in the erectile mechanisms, that's a major warning sign. The bigger ones, like the arteries going to your heart and your brain, those might be struggling too. And guess what? Arteries that size supply your eyes and your kidneys. So if you're having ED, be thinking and worrying a little bit about your eyes and your kidneys. Citrulline helps restore nitric oxide and improves endothelial function. Sorry about that. Endothelium and endothelial function. That's that lining of the artery wall. It's very delicate. It's thin. It controls whether your blood vessels stay relaxed or go into spasm. That's what we're talking about. One study found that men with mild erectile issues saw a measurable improvement after just 1 month of citrulline. Think about it. So, yep, the same molecule that helps you walk farther might just help you stand longer too. Part 6. How much to take and when. Most studies use 3 to 6 grams per day of L-citrulline or 8 grams of citrine malate. That's a form used to bound to malic acid, but let me back up for a second. This is the first time I've brought that up. There are 2 forms of citrine to take. One is just plain old L-citrulline, and that's the one you should take for arterial health. If you're more focused on function, muscle function in the gym, then take the citrulline malate. If you're taking L-citrulline for the arteries, 3 to 6 g per day. If you're taking the citrine malate for working out, that's 8 g. Take it about an hour before exercise. Split the dose morning and evening if you're using it for blood pressure control. I like powdered versions. They're easier to measure, easier on the stomach, and if you're already taking beetroot powder or other nitric oxide boosters, citrulline pale pairs very well with them, especially in the powdered form. Now, here's a mistake that I see people take all the time or make all the time when they're taking it. They take it with a high-fat meal. High-fat meals slow absorption. They delay nitric oxide production. For best results, take it on an empty stomach or at least 30 minutes before eating. Part 7, Stacking and Safety. Citrulline is generally very safe. Your body naturally regulates nitric oxide levels, so you're not going to overdilate your arteries. In fact, most of the reported side effects come from the fillers or flavorings, the cheap powders that some groups use, not the citrulline itself. If you're already on nitrates like tadalafil or sildenafil Cialis or Viagra, if you're already taking those, make sure to talk to your doc before you take them before you add citrine, because the combination can drop your blood pressure, sometimes even a little too low. If you're dealing with kidney disease, you'll also want your doc to guide dosing for that. But for everybody else, it's one of the simplest, safest, most effective ways to boost vascular health and blood flow performance. Part 8, Bonus Benefits. Citrine helps your muscles clear lactic acid. It improves recovery and even supports the urea cycle. Don't need to remember that part, but just remember it helps remove waste products like ammonia and lactic acid from your blood. So your muscles improve, they recover better. This translates to less soreness, better endurance, more consistent energy. It's one reason a lot of athletes over 40, like me, are rediscovering citrulline. It's not a stimulant. It just helps your body use oxygen and nutrients more efficiently. For my patients, it's a foundational tool. It's not a miracle pill, but it's a smart lever to pull. It helps every other health habit work better. If you want your arteries to act young again, don't just focus on cholesterol, focus on function. Citrulline helps your arteries open, your blood pressure stabilize, your workout feels smoother, and yes, it even brings back a little bit of confidence in the bedroom. Start with a little small dose, be consistent, and remember, the goal isn't overnight magic. It's giving your arteries the raw materials they need to heal themselves. Remember, growing old's not for sisses, but it's a lot easier with healthy.